Now joined from our Pretoria studios by Dr. Angelique Coetzee from the South African Medical Association. Good afternoon, Doc, and thank you for your time on the SABC News Desk.
Thank you, Karnishi, and good afternoon to all the listeners out there and viewers.
Doc, thank you. What are some of the key considerations for the repatriation and quarantine for those returning home in relation to the outbreak of this virus?
I think that so far the precautionary measurements that's been put in place by the Department of Health is the correct ones to have. They are following the World Health Organization guidelines. Also remember that these people coming back has been for quite some time now in Wuhan, and they are, for all practical reasons, healthy. The South African government goes one step further, and instead of the 14 days of quarantine, they go for 21 days of quarantine. It's important to understand that all the medical personnel will have the protective gear, while the patients, or it's not yet patients yet, but the people in quarantine will have also certain precautionary measurements that they will need to adhere to.
Doctor, can you give us a sense of what actually happens during a quarantine period in the country?
We need to, it is not a simple answer to that. You need to understand there's two types of quarantine. The one type of quarantine is where you try to get people to not be infected by the virus. So you have people that's not infected yet, possibly might have it underlying, but it's not infected. So those people, normally in a place like South Africa, what we need to do is self-quarantine at home. In the case of the people coming from Wuhan, where we know that they have been infected, well, in a city that is having the virus, you will take the precautionary measurements as what is done by the Department of Health. Then you have patients who are really patients who are sick, and they need to be admitted, and that's a different type of treatment and quarantine measurements that needs to be in place for those people. So it's not a one-size-fits-all. You have a place out there and then you can quarantine anyone. You quarantine people that's healthy, make sure that they do not spread or don't have a virus underlying. We know the virus is maximum 14 days, so 21 days should be sufficient enough for people without any clinical symptoms of the virus. So that's one part. If you are having symptoms of the virus, 80% of people will have mild symptoms. That is self-quarantine at home.
Doctor, just on that point, can you just explain the difference or elaborate on the difference between isolation and quarantine for us?
Okay. Isolation is if you look at the stats, 80% of people will have mild disease. Some of them won't even know that they have the disease. The problem with those mild diseases is that they can spread the virus and you don't know who of them are what we call a super spreader. Also important to understand that those people can shred the virus through their skin's virus particles. So if you go and then you get your 15% that will be ill. Of those, about half of them will severely ill and they will need isolation. They will go onto a ventilator, and this is where the problem also starts. So if they are admitted in the hospital, that isolation room must have negative pressure with its own ductus system where the virus needs to be getting out of that room via the aircon system. The aircon system cannot be linked to the rest of the hospital because you will spread that virus into the rest of the hospital, which will become a death trap. So isolation means negative pressure, protective gear, you will be ventilated, and there you will have a 50% death rate. Otherwise, isolation is not the same as quarantine, where these people will be able to walk freely around in that perimeter. They will not be able to go out. They will be tested. Again, the doctors will have the protective gear. In surgeries and in casualties, we do not have protective gear, so it is very difficult to let patients come into a surgery because there's not isolation areas in the average surgery of doctors as well as casualties. So that brings us to another problem.
All right, Doctor, what happens in the very unlikely event of suspected cases detected at arrival?
Are you now talking about the patients or the people coming in from Wuhan?
How will they be handled? How should they be handled at the point of entry?
Okay, what will happen when they at the point of entry, there will be medical tests performed on them. They will get throat swabs, they will get a blood test, and that will be sent away. They will have hopefully a 3-layer mask on their face, more to protect themselves from spreading viruses to other people, as protecting viruses coming through the mask. So they will then be monitored for temperature as well, for a cough, and certain, it's flu-like symptoms. So you will be monitored and screened for that. Then that will, I'm not sure what the protocol is of the current, the Department of Health has in mind, but that will maybe happening every third day. If a patient, or if there is a suspected case on day 20 of the 21 days of quarantine, it means that the quarantine period will be extended for another 21 days.
Dr. Angelique Coetzee from the South African Medical Association joining us from our Pretoria studios. Thank you for your time.